New at 6 tonight, the Jefferson City Fire Department is one of more than 80 organizations across the state that's part of a critical illness pool to help firefighters diagnosed with cancer. But Columbia's potential participation is at a standstill. The Missouri Firefighter Critical Illness Pool is a program available for public agencies that serves as an alternative to workers' compensation. There are different coverage limits that cities can choose, and that determines how much a city pays into the program annually. The program's website says it would allow firefighters diagnosed with cancer to receive funds more quickly and cut down on invasive investigations. It also cited that it'd save some cities money. The Columbia Professional Firefighters Union president tells me they've been negotiating with the city about joining this pool for 2 years now.
Why we are not there already and weren't leading in this charge is really unacceptable to me and to our membership.
When I reached out to the city about this, I was directed to Columbia Fire Chief Clayton Farr.
There are times when decisions have to be made and/or decisions are delayed, which may give people reason to pause or reason to doubt. And I just, again, want to rest assured for our staff and our community that our firefighters are my #1 priority.
Farr says while the city is open to negotiations, it offers good health benefits and focuses on prevention rather than spending money on the fund.
From a City of Columbia standpoint, we've not told the firefighters no. We've told the firefighters not yet.
But Prevette says being a part of this pool would be a fraction of the city's budget and would likely cost less than workers' comp payouts.
For our members in the City of Columbia, it would cost roughly $25,000, maybe $30,000. And looking at our 24 adopted budget, that's 0.0001% of the general fund budget this year.
There still seems to potentially be some financial uncertainty with regard to municipalities in terms of a cap on how much this pool will cost moving forward.
Meanwhile, no more discussions are currently scheduled. Is this overdue in Columbia? Why has this not happened yet?
Yeah, it is. It's very much overdue.
Prevette tells me if the city refuses to negotiate in good faith, there's potential for litigation.
We're willing to do whatever it takes to make sure that we're covering our guys, and if that ends in a courtroom, then we're ready to go.
The union requested mediation to discuss the issue, but Farr tells me it's since requested to pause mediation. But when I asked Prevette about this, he told me mediation was paused for other issues and not for the critical illness pool discussion.